to briefly say the top 2 ways that from your own vantage points, this year is really different than last year and perhaps than you have been expecting it to be. And we're going to do sort of a mini countdown. So if you could start by each giving the second biggest way that things are different than you thought they would be, and then we'll go through and get your top nominee. Right. So Marilyn.
All right, I'll start with basically some of the technical changes, not as it relates to healthcare.gov, but as it relates to the open enrollment timeframe. And this is something that the Trump administration had put out in rules earlier this year, and something that AHIP had supported, which was to align the enrollment period closer to what has been typical for Medicare or typical to an employee or employer market. So it's now November 1 to December 15th. So you're starting with a much shorter time frame, and you're also not moving into the next calendar year, which created problems with folks who were trying to get new cards or switch carriers at the beginning of a calendar year. So because it's in a short time frame, and then obviously we've had some other things happen, it's very important that people understand there's only a 45-day period this year, much shorter.
Okay, so the compressed time frame.
Yes.
Peter.
Yeah, I'd say that the number 2 thing is not what's different, what's the same in California, which is we have a full 3-month open enrollment period. We've got the same 11 plans as last year. We have competitive prices. And for California, it feels like an alternate universe. So that's what's different, is that last year we were one of many states that were sort of moving ahead with things coming in balance. This year, one of a few states that's still in balance in the concert with what's happening nationally.
All right, Jody.
I would say probably one of the unexpected changes was the reduction in the funding for navigators, which means fewer people on the ground to provide those enrollment assistance services. I think that was unexpected, definitely a change for this year.
Okay.
Yeah.
I'm surprised that's not your number 1.
I'm curious about your number 1 too now.
Okay, so what's your number 1 pick?
So for me, it's probably just the ongoing confusion and instability that led to insurers pricing 2, 3, 4 times this year, depending on who was on the news the latest, right? So we have actually states that had 4 sets of pricing, and then at the end still had states that will now have to go back or are going back inside certain states and repricing based on the cessation of the subsidies or the cost sharing reductions. So I'd say just confusion and repricing has been the number 1 issue about then how do you try to market it when you haven't settled on what you're doing. So.
Okay, Peter.
I think for us in California, it's the very loud, distant thunder from Washington, which is incredible uncertainty, and then having to manage for that uncertainty. And in California, we've done a lot of things to manage it, to give our plans certainty so that they'll participate, which they are again, and give consumers certainty that they'll have the same choices, the same options, and good prices. But we're swimming upstream in a way that we haven't had to swim upstream in a long time.
Okay, and Jody.
I think going back to what you said to begin with was, how the last 2 open enrollment periods sort of got almost routine. And in some ways, that was almost a good thing. I mean, I can speak for Florida. We saw an increase in enrollment each year of open enrollment. So we didn't see consumers get lax. What they got was more informed and more confident. So they were more engaged, and they were able to come in with a lot more information. I think we really achieved something. Now we're going back to the first year, and I think one of the biggest changes we're experiencing this year, particularly after the last 3 years, was that our consumers are not more informed. They're more confused than ever. They are more uncertain, and some of them are actually letting premiums lapse because they thought the law was repealed. They are really not as informed as we had hoped they'd be by year 5 because of this.